is Caroline King, and today I'm going to be discussing the steps for mental health reform. The National Institute for Mental Health reported in a given year 1 in 4 Americans will experience a form of mental illness. That means in the next year alone, 25% of the people attending Virginia Western will have to deal with some type of mental illness, regardless of severity. As someone who has personally seen the damaging effects of mental illnesses, it's evident that steps need to be taken to reform the system. Mental health policies within the United States should be reformed to increase funding, increase access, and increase enforcement in order to improve the current status of mental health. The first step in the process of reforming the mental system is to increase funding. According to a study conducted by the National Alliance for Mental Illnesses, 11 states decreased their mental health budget in the 2015 fiscal year, while 23 states increased their budget that same year. While these fundings sound promising, in the same fiscal year, the study found that states dropped their budget drastically. In order to have an effective mental health system, funding at the state level is essential. In order to acquire a universal mental health plan, federal funding is imperative and must be implemented to see change. Great strides have been made in past years in terms of mental reform, but it is evident that more funding is needed. Mental health funding makes up only 5.6% of the national budget. Of the funding allocated to mental health, most of it covers prescription drugs and outpatient treatment. Additional studies found a direct link between inadequate funding and access to mental health care. Of those currently not under care, the main deterrent was money. Increasing access to resources for mental illnesses is directly related to the amount of funding provided for programs and policies. Historically, when decreasing mental health funding, inpatient care took the greatest hit. The negative effects of limiting inpatient care was seen firsthand when Senator Creigh Deeds of Virginia came forward with the story of his son's personal battle with mental illnesses and the inefficiency of the mental health system. Senator Deeds had attempted to bring his son to a mental care facility in November of 2013, but was turned away due to a limited amount of beds. The next morning, his son attempted to kill his father by stabbing him repeatedly and ultimately took his own life. Senator Deeds believes that if beds were available at the local mental health facilities, his son would be alive today. Senator Deeds has dedicated his time and efforts to improving and reforming the mental system, specifically focusing on inpatient care. In addition to limited access to inpatient care, the entire field is struggling to obtain the needed medical professionals in hospitals and outpatient centers around the nation. There is a great shortage in the amount of mental health care professionals available. Waitlists, insurance issues, and limited number of professionals all are factors to the limited access to care. Increased access and increased funding go hand in hand and are both equally important to having and improving the current state of the nation. Legislation has been increased in an attempt to combat the issues, but legislation has failed to be implemented in many cases. Further enforcement is needed to address the mental health system. The difficult reality of most psychological disorders is that it's a lifetime battle. Unfortunately, even years after ending therapy or being discharged from a hospital, a patient is still at an increased risk for mental illnesses. In order to ensure sustained mental health, it is important to have support groups, such as group therapy, and friends and family surrounding the individual. With the extreme reliance on social media, campaigns in the United States have taken to Twitter to encourage social reform. The movement #EndTheStigma addresses the common stigmatisms surrounding mental health in an attempt to encourage those struggling to speak up and to enlighten those who are less informed on the topic. Through increased funding, increased access, and increased implementation, the United States will reach an effective mental health policy that works for everyone.